My name is Dr. Michael Cohn. I'm an orthopedic hand and upper extremity surgeon with Baptist Health Orthopedic Care. Cubital tunnel syndrome happens behind the elbow through a separate tunnel for the nerve called the ulnar nerve. This tunnel is naturally called the cubital tunnel, so we call this condition cubital tunnel syndrome. It is one of the most common nerve compressions in the arm. Pressure on the nerve creates sometimes radiating numbness and tingling to the ring and the little finger. As the disease progresses for some, you can develop hand weakness, which can affect daily activities using the hand. Sometimes women complain of difficulties in putting in their earrings or doing their hair in the morning. Other activities that we do all the time, like driving, cell phone use, where we're bending our elbow and keeping in that position, can aggravate the nerve compression and further progress the disease. During the day, we have patients try to modify their habits, try not to lean directly on the back of the elbow, directly putting pressure on the nerve, or avoiding prolonged folding of the arm. Once modifying our habits and splinting is no longer effective, these are the best candidates for surgery. You should always try non-operative care first. One way to diagnose nerve compression syndrome, such as cubital tunnel syndrome and carpal tunnel syndrome, is what's called an electrodiagnostic test. The electrodiagnostic study can tell us more information about which nerve is being compressed and how severe the condition is. A patient should see a hand surgeon like myself for conditions like cubital tunnel syndrome when the symptoms begin. Number one, to get a diagnosis to confirm where it's coming from and to start with appropriate non-operative treatment in hopes of resolving the condition before surgery is even necessary. Certainly a patient should see someone like myself for this condition. If their symptoms are becoming more frequent, one should definitely seek attention before the symptoms are constant and severe, where they're dropping things or they're having loss of muscle mass in their hands. Constant symptoms of numbness also can be a marker that one is developing nerve damage. Ultrasound-guided cubital tunnel release. It's different than traditional surgery, which can involve a large incision behind the elbow of many inches in length. Many times surgeons will even move the ulnar nerve from its natural position to put it in front of the elbow, putting it under the muscles of the forearm. This requires a prolonged recovery, sometimes splinting or casting for 4 to 6 weeks before beginning a rehab program. The benefits of ultrasound-guided cubital tunnel release are that the incision is very small, therefore the dissection is very, very small. The postoperative pain also very, very small. We still are able to release the nerve just as well as an in situ release. It's just done minimally invasively through a small incision and under local anesthesia, which is also a big win for patients. They can avoid the time and costs associated with having to get medical clearances, preoperative testing. Even the day of surgery, they're wide awake. They don't even get an IV. A lot of them get a kick out of the procedure itself and being awake and being a part of it. But the great thing for patients is that they recover very, very quickly and they get back to their lives, their hobbies, their work activities extremely quickly. I think ultrasound-guided, minimally invasive surgery of the hand and upper extremity is the future and will become more and more widespread over the coming years. It's really exciting to be part of Baptist Health Orthopedic Care, where cutting-edge technologies help patients get better faster.